Thank you, Chairwoman Velasquez and distinguished committee members. I'm Dr. Ann Schuchat, the Director of the National Center for Immunization and Respiratory Diseases, and delighted to be able to update you on the H1N1 situation. Increased disease from the 2009 H1N1 influenza virus has already begun in the southeastern states, and we expect in the coming months more and more communities around the country to experience increases of influenza, including this new virus. Communities may be more severely affected, reflecting wider transmission and potentially greater impact. Seasonal influenza viruses may continue to circulate at the same time as the H1N1 virus this fall and winter. It's also difficult for us to predict the severity that these outbreaks will have, the number of hospitalizations, the deaths that will occur due to either the H1N1 virus or seasonal flu. Small businesses play a vital role in community functioning during influenza pandemics. They form the critical backbone of supply chains for larger businesses and are central to the strength of local economies. Many healthcare providers are also small businesses, and they are critical to caring for patients, to delivering vaccine, and to managing and informing influenza decision-making in their communities. Yet small businesses also suffer disproportionately during disasters, and they're especially susceptible to the negative economic impacts of an influenza pandemic. The CDC and Health and Human Services works closely with the Department of Homeland Security, the Department of Labor, Department of Commerce, and the Small Business Administration to help small businesses address issues they may face during an influenza pandemic. In response to our expected spread of the 2009 H1N1 influenza, CDC has updated our recommendations to assist businesses and other employers of all sizes. And in fact, we are now working on updating guidance that will address the small business community in particular. The guidance for small businesses will recommend that small businesses should plan for and respond to two possible scenarios. One, where the severity of illness is similar to what we saw in the spring and summer, and a second scenario where severity might be worse. Even if the severity of this virus doesn't change, though, small businesses should expect that there will be more illness this fall and winter, and that this may significantly raise the levels of absenteeism and could have an impact on their business operations. That second scenario of greater severity involves more people becoming ill with severe illness, more hospitalizations, and even more deaths, an even greater escalation of absenteeism. Businesses need to be ready to implement strategies to protect their workforce while ensuring continuity of operations. During an influenza pandemic, all sick people should stay home and away from the workplace. Hand washing and covering your cough continues to be important, and routine cleaning of commonly touched surfaces is also important. Employers of all sizes should consider plans to implement flexible sick leave policies. CDC recommends that employees with influenza-like illness stay home until at least 24 hours after their fever is gone. Sick employees would be out for about 3 to 5 days in general, even if antiviral medications are used. Businesses should also not require a doctor's note for workers who are ill and with influenza-like illness to validate their illness or to return to work. A doctor's visit might excessively strain the health system and isn't needed for most people with influenza-like illness. Businesses should also inform employees that some people are at higher risk of complications from influenza. People at higher risk should check with their healthcare providers if they become ill. Early treatment with antiviral medicines is very important for people at high risk because it can help prevent hospitalization and death. CDC also recommends businesses encourage employees who are recommended for the seasonal flu vaccine and for the 2009 H1N1 vaccines get vaccinated as soon as those vaccines are available in their communities. Small businesses should consider developing other flexible leave policies to allow workers to stay home to care for sick family members or for children if schools dismiss students of child care programs or if child care programs close. It also may be helpful to consider ways to cross-train workers to perform essential functions so the workplace is able to operate even when key staff are absent. To maintain critical operations, small businesses should be prepared to change business practices as needed during an outbreak. Small businesses should prepare to identify alternative suppliers, for instance, or prioritize customers, or temporarily suspend some operations if that's needed. So I want to end with stressing 4 points. that small businesses can take. Plan now to prepare for the impact of flu this fall and winter. Take into account 2 planning scenarios, similar severity and greater severity. Protect your workforce by encouraging people to stay home if they're sick, and take steps to maintain continuity of operations, even during high levels of absenteeism. We're working across government to try to develop practical, clear guidance and tools that small business can use to protect their workforce and maintain operations during what I think is going to be a challenging flu season. Our nation's current preparedness is at the greatest stage it's ever been, but we all need to work together going forward, and I look forward to working with the Congress and answering your questions.